Hello, I'm Jane Williams. Welcome to Webinar 2. This webinar covers practice governance. Country SAPHN acknowledges the traditional custodians of the lands we live and work on and pay respects to the elders, past, present and emerging. We recognise and respect the unique cultural and spiritual relationships to the land, waters and seas, which continue to be important to Aboriginal and Torres Strait Islander people today. The objectives covered in this webinar are strategic planning, risk management, complaints resolution, emergency response plan, and confidentiality. Strategic planning. The practice plans and sets goals. The practice plans and sets goals aimed at improving services. It has a strategic plan and evaluates progress towards achieving that goal. Business plan. This can be a complicated business plan with goals to be achieved over a set period of time, or it can be as simple as how to increase immunisation rates or increase care plans. Reflective to change. Do not make it more complicated than necessary, but do make it reflective of a change the practice wishes to make. Second plan if needed. Sometimes the practice does not wish to show the surveyors detailed financial plans of the practice. If this is the case in your practice, develop a second plan without financials. Risk management. Business risk management. This means that the practice has a system in place that identifies, monitors and mitigates risks in the practice. Risks involved. There are a number of risks relevant to business, and they include compliance, security, fraud, financial, reputational and operational. Data protection has been in the headlines of late. Managing risks. Often when a practice is asked about risk management, the answers are confusing. Think about risk management that occurs in your home. Moving a mat that someone has tripped over. Placing all extension cords safely out of the way. Recoiling the hose after use. All these relate to risk management. Now look around the surgery. Is there anything a patient may trip on? Are the cups for water out of children's reach? Are the patients aware that there are arrangements in place to access after-hours care? Whilst these things are commonplace, they also relate to managing risks within the practice. Addressing risks. The practice must have in place systems to address these risks. Complaints resolution and near misses. Policy to address complaints. The practice must have in place a policy to address complaints from patients and others, and must have someone who deals with these in a timely manner. Health and Community Services Complaints Commissioner contact details. If a patient feels their complaint has not been handled well, please ensure the information for contacting the Health and Community Services Complaints Commissioner is readily available. Complaint logs. Keep a register of complaints and all documentation relating to the complaint. Where possible, ask that complaints are made in writing. Discuss how the situation was handled and the outcome. Adverse events and near misses. A register must be kept of all adverse events and near misses in the practice. Discuss at practice meetings and make this an agenda item at each meeting. Emergency response plan. The practice must have an emergency response plan for unexpected events such as natural disasters, pandemic disease outbreak, or unplanned absences of clinical staff. Emergency contact details. All major services, telephone, gas, electricity, water, SES, CFS, MFS, pharmacy and hospital should all be listed with contact numbers. Printed copy of plan off-site. Principal GPs, practice manager and any other parties deemed necessary should have this as a printed copy and also have it kept off-site for use in after-hours situations. Your IT provider should also be listed as he or she will be responsible for getting the practice up and running in a state of emergency. Bushfires across Australia and the COVID-19 pandemic has reinforced the importance of an emergency response plan. Confidentiality agreement. Confidentiality in general practice is of high importance. All staff must sign a confidentiality agreement on commencement of working in a practice. Individual logons. All staff and GPs will have individual logons and passwords for computer access and security. Limited access to patient files. To ensure implementation of confidentiality, sometimes staff are given limited access to files as an added means of security. Instant dismissal. Accessing patient notes without permission or any other breach of confidentiality can be means of instant dismissal. Do not disclose and discuss. Never disclose any information to anyone unless instructed, preferably in writing. Never discuss patients or treatment with another staff member. Thank you for taking the time to join this webinar today. Country SAPHN gratefully acknowledges the financial and other support from the Australian Government Department of Health. For resources, you can email us at support@countrysapHN.com.au. Resources can also be found online at agpal.com.au and the 5th edition standards from the RACGP.